Sierra, it looks like you're looking into my soul. All right, just a couple more minutes. Is anybody, any of our early arrivers, planning to go camping at Lake Lucille tonight? Show of hands. Anyone? Anyone? All right, we'll see. We have, as a reminder, we have the campground reserved for CCS employees for tent spots tonight. That was a request to our wellness committee, and they made it happen. So feel free to bring a friend or get together with friends.
I will be at Underground Pride as a United Way representative. We're going to have a table there. So if anybody's coming out to the fairgrounds for that, we'll be in Raven Hall.
Awesome.
I've got cool swag. So.
There's a lot going on this weekend. Like we were trying to make weekend plans, and there's like a big music festival up at Hatcher Pass, at Ski Talk. Lots going on. All right, I think I saw Wasilla trying to join. Wasilla Head Start, I'm guessing you're a group, maybe? Yes, you are. Hello, good morning. Abby's on, Pat's on, Amber's on. We'll give the on-time arrivers just 45 seconds more here. All right, we are going to go ahead and get started. I'll just give a couple of like housekeeping things. Teams is not our usual platform, so some of you might be figuring out where things are. If you want to make sure that you're muted and your camera is either on or off, whatever you choose, those buttons are in the upper right. Next to the leave, the red leave button. Don't press that red leave button unless that's what you're trying to do. But that's where your controls are. And then, you know, wherever you are, that's where your exits are and your bathrooms are. So, you know, feel free to come and go as you need. We are recording this. So if you have to duck out or if your coworkers aren't able to join, we're going to share the recording afterwards. We're also going to share these slides that Jennifer has as well. So don't feel like you need to write down everything that she talks about. I'll send the slides out as soon as she's done. So I just want to introduce Jennifer. Jennifer Brandt is with the United Way of Anchorage. She actually lives out here in the Valley, though. And I don't know how many folks are familiar, but part of the implementation of the marketplace or healthcare.gov or whatever you call it includes healthcare navigators that help educate the public and guide the public, help them navigate what this thing is and how it works. And that is her job. And it's changing, actually. I think she was telling me there's 11 or 13 navigators
13.
currently.
Mhm.
13. And in a month or two, there will be like 1.5 or 2 navigators, because that's part of the federal changes that are happening. Some grants that fund those navigators are going away. So she actually is facing a career change. I think excited, maybe. She's going to be the new executive director of the Palmer Food Bank. So that's why she was trying to figure out Palmerites or Pomeranians or whatever with you guys over there, making sure she's got all her terminology right. So we're excited to get to know her before she starts that job. And we partner a lot with providers of basic needs. Our families rely on those. So we probably will see you in your future role on a regular basis too, Jennifer.
Be great.
So again, being recorded. Please ask questions, though. That's the reason we're recording it, is so that your questions can get out there and everybody can hear the answers. I also just wanted to clarify a couple of things about the survey and some of the feedback that we've gotten. First, I just want to say thanks. Those of you that have taken the survey, currently we've got 90 responses to the survey, and you guys have provided amazing feedback. And I just want to thank you for doing that. It's all over the board, as we knew it would be. This impacts everybody so very differently. A couple of things I wanted to clarify, because I think there were several things that were confusing. Multiple people made comments about a dependent coverage. And I think the confusing thing there is this thing that we're considering is only related to health insurance. We're not considering at this time any changes to health, to dental or vision. And so we absolutely have employees who have dependent coverage for dental and vision. But currently we have no employees that have dependent coverage for health because it's just very expensive. It's very, very expensive for the employee. So I just wanted to clarify that because that came up several times in the survey. And then the other thing that came up in the survey I just want to talk about too is, people felt like this decision had already been made. And I just want to assure you, this decision has not already been made. The reason we started this conversation so early in the year is because there is a lot to consider. It's such a big change, and it's so impactful for all of you and for our agency too, that we really wanted to take the time to talk this through and make sure that we got your feedback and you were able to learn all about the issue and think about the options as well and provide that feedback to us. So the survey is our primary way to get your feedback. If you haven't taken the survey, we have until the 15th. So please jump in there. You can even take the survey again. There's no limits on, clicking on that link. If you learn something today and you want to jump back in and share that, feel free to do that. Or if you have additional questions after today, feel free to do that. You're only going to get the $100, bonus in that survey. But if you have additional thoughts or questions or concerns, jump right back in there. It's all anonymous. We don't know, who's saying what, anything like that. It's the important thing is getting our employee feedback. So with that, I'm going to turn it over to Jennifer, and she's just going to tell us all about the marketplace. Again, we wouldn't, if this decision was made, this would be down the road. And at that point, there's only going to be 1.5 navigators. And so we're trying to get this information from her and kind of education now so that employees would have time to research it thoroughly and be educated about it. So that if we get to that point, we'll be more knowledgeable and walk our way through it. So Jennifer, I'll just turn it over to you.
Great. Well, thank you so much for having me. And I'm excited to be here. I'm very passionate about health insurance. I was a health insurance agent before the Affordable Care Act. I used to call it the wild, wild west of the insurance industry. And things have gotten so much better. But I know that probably doesn't give anyone comfort. But so I'm going to talk to you today about the marketplace, some Medicaid health insurance options. Keep in mind that this is all information from 2025, and with the new federal administration and Congress, things are going to be changing. We have an idea of some of the changes, and like I was telling Mark earlier, some of those are fluid. They're making changes and then reversing them and making changes last minute, things like that. So, and a lot of things are going to sunset, just provisions that were part of the law, but they're just not going to be renewed. So I'm going to share my screen. If you want to ask questions, we do have a time at the end for questions. If you want to type those in the chat as we go, I'll try to address them as we can. And Mark is going to monitor the chat for me. Thank you, Mark. So I'm going to share my screen here real quick and we'll get started.
And again, for those of you, those of you that are in group settings, I know that your screen might be harder to see, but we will send the slides out to everyone.
Absolutely. So, heavy subject, but we can have a little fun with it. So I like memes, I like cartoons. So this one says, laughter is the best medicine, but your insurance only covers chuckles, snickers, and giggles. So tough times. So what is the federal marketplace? So basically it's the website where you obtain your health insurance. So some people call it healthcare.gov. That is the kind of the known name for it, but it also goes by the ACA, which is short for the Affordable Care Act. The Health Insurance Exchange. A lot of people know it as Obamacare. I can't tell you how many people come up to me when I'm out in the community and go, is this Obamacare? And yeah, it sure is. Or the federal marketplace is another name for it. Or if you're in the industry, you call it the FFM, which stands for the Federally Facilitated Marketplace. But this is the website here, and you can just go, straight to that website. So I'm talking a little bit of the highlights here. So cost, I had noticed that in the survey that Mark had shared with me that a lot of people were concerned about cost for plans on the marketplace. Most plans in the last couple of years are costing people about $10 to $50 a month per family member, which really isn't that bad in the scope of things. But cost is based on several factors. It's based on the modified adjusted gross income of your taxable household, things like your age, location. The older you are, the cheaper the health insurance is going to be. The younger you are, the more expensive it's going to be. So for once in our life, as we age, it's a benefit. Coverage, every plan offers essential coverage, access to doctors, mental health, substance abuse, misuse treatment, preventative care. And I'm going to go over preventative care in detail. Preventative care is covered at 100%, and it's a great category. And then also too, there are no pre-existing condition clauses or lifetime limits. Now there used to be like $1 million limit on a policy. So once you hit $1 million in your lifetime, you were no longer insured, which was a nightmare for people that had cancer or had a premature baby that was in the NICU, things like that. But that has been reversed, and I don't anticipate that ever coming back. There was a comment in the survey about not being able to get coverage because of pre-existing conditions, including pregnancy. And it's not necessarily about the condition you have, it's about the timing in which you get your insurance. And I'll talk about that in a bit here too. And then of course, citizenship. Most people do qualify for marketplace coverage as long as they're US citizens, in the country legally, and things like that. So, next slide here. So how does this work? Well, the big thing with the marketplace is premium tax credits. So based on your modified adjusted gross income, which is your adjusted gross income with certain deductions. So if you are contributing to an IRA, not a 401k or 403b, but an IRA, that if you are paying alimony, there's certain things that you can deduct. And what you get is called an advanced premium tax credit. And essentially that is the subsidy that the federal government is going to give you, but they're going to send that directly to the insurance company every month on your behalf. If there is any balance after the advanced premium tax credit, that is what you pay monthly. The advanced premium tax credit is reconciled with your taxes. It's pretty seamless. You're not really going to see it until you go to file your taxes. And similar to with your group health insurance, how you get a 1095C, you'll get a 1095A that will come from the marketplace. And with that 1095A, you're going to need to file a form called a 8963. So if you have your taxes done, or if you use TurboTax, all of this is in there. It's just kind of known. Also, too, if you call 211 during tax season, we partner with AARP to provide free tax services regardless of your age. So keep that in mind because that's a great service. Another caveat is if you underestimate your income when you do the application, you could possibly have a tax consequence. Because if you underestimate your income, you're going to get more of a premium tax credit than you should have gotten. So if you overestimate your income, you're more likely to get a refund. So it's always better to err on the side of overestimation. Eligibility. So there are eligibility requirements. So you have to live in the United States, regardless if you're a United States citizen. So if you live, if you plan to move to Norway and you still want to maintain your United States citizenship, you're not going to be able to get the marketplace. If you're married, you are required to file taxes jointly unless you are in a domestic violence situation or you have your partner is unreachable, something like that. You can't have an offer of coverage from your employer or your spouse's employer. Okay. You cannot be in jail. So if you have a family member that is on your taxes, or if your partner is incarcerated, unfortunately, they cannot be covered. You cannot have other health care. So things like VA, CHAMP, Medicaid, Medicare. Indian Health Services, IHS, is not included. So if you do have Indian Health Services, you can still get marketplace coverage. There is a program called the Tribally Sponsored Health Insurance Program that I also am on the team for with ANTHC. I'll talk a little bit more about that. But if you have Indian Health Services and you don't have an offer of coverage, they will actually purchase you a Primera plan free of charge. And it is an incredible program. And then also immigration status, you have to be in the country legally. And unfortunately, last year, they excluded DACA residents. So there's a lot of changes for 2026. This first one you may or may not have heard of. It's called the family glitch. They have reversed that. So essentially, if your health insurance through your employer was more than 9.2% of your family's gross income, you qualified to get health insurance through the Affordable Care Act. They have since reversed that. I have a lot of people that I have worked with who have taken advantage of that family glitch. But unfortunately, that is going to no longer be for 2026. You're going to have to provide proof of your special enrollment period if you have one. So typically you could just type in there, this is when I've lost my insurance in the application, and it would say, okay, you qualify. Now you actually have to have proof of that. You'll have to upload documents. Another change is tax filing. You will not be eligible for an advanced premium tax credit if you have not filed taxes for the previous year. So if you go to apply for 2026 and you have not done your taxes for 2024, you will not qualify for an advanced premium tax credit. Policies will no longer automatically renew. In the past, if you had a policy, through the Affordable Care Act, through healthcare.gov, during open enrollment, if you didn't go in and make any changes, they would automatically enroll you in that plan or a similar plan in the next year. They're not going to be able to, that is not going to happen this year. Medicare eligibility may affect family members. I'm going to go into this a little bit more detail later because it's kind of complicated. I'll just leave it at that. Right now, you can get a special enrollment period if you fall above 101% and 150% of federal poverty level. So you could get insurance at any time of the year. You didn't have to wait for open enrollment. They are also eliminating that, unfortunately. And income limits. If you are over 400% of the federal poverty level, they will no longer offer you an advanced premium tax credit. So what I have done is I have included this chart here, and you can kind of see, and I don't know if anyone can see this in our crowds there, but you'll have these slides. But this is specifically for Alaska. Keep in mind, this is 2025. Typically, they update this in April of every year, but you can kind of see here your family household size, and this means who's on your taxes. So if it's you, your spouse, and 2 kids, you're a family of 4. If you're making more than this, you're not going to get an advanced premium tax credit. You can still purchase health insurance, you just won't get a subsidy. Okay. which is a big bummer, by the way.
Jennifer, do you
And-
want questions as we go, or do you want me to hold those?
Absolutely. Yeah, but this is a great place to stop.
So one question here is, Patrick says, on the website, it tells me I'm potentially eligible for a tax credit, but when I actually apply, there is no tax credit.
So that could be for many, many reasons. And as my supervisor likes to say, we need to make the application behave. So a lot of it is very nuanced when you get into these applications. And if you just hit a certain thing, it could throw everything off. So I'm happy if you've already applied, I'm happy to go into the application with you and see what that reason might be.
Okay. And that actually would be if this were made, right? We still have employer coverage. Nobody should be applying right now.
No, nobody should be applying right now. And you wouldn't qualify
Yeah.
because you have an offer of coverage through your employer unless it's
Right.
unaffordable. But even then you would have to have applied during open enrollment. So yeah.
Correct. Yeah. And then Redono wants information about the tribally sponsored program. So maybe you could send me a handout or some information about that. We'll pass that along to all employees as well.
Yep.
Perfect.
And then, go ahead, Redono.
That's exactly what I wanted. Something to read.
Yep. And then Summer asks, if I claim my child every other year on my taxes, does that affect my household number every other year?
Absolutely, it does. So for the years that you don't claim your child, you're going to go down to, one less household member.
Great question. Thanks, Summer. All right, that's it for now.
Okay, great. So the two insurance companies that insure on our marketplace are Primera, Blue Cross Blue Shield of Alaska, and MODA. So we only have two insurance companies because we're a very small market, believe it or not. I think Texas has 240 plans that you can choose from. In Alaska, typically we have 15 to 16 plans. It had been about 16 plans the last 2 or 3 years. This year they dropped it down to 15. We don't know what those plans are necessarily going to look like or how much they're going to cost. They don't announce anything until the last week of October, which is the first week, which is about a week before open enrollment. Plans are categorized in metals. So you have bronze, silver, and gold, just like the Olympics kind of, but not really. So the lower the category, so bronze obviously is the lower category, the higher your deductible is going to be. And you're going to have higher out-of-pocket costs. Silver, you would think, is going to come in next, and it does on this chart. However, in Alaska, typically it does not. Typically, it's more expensive than the gold plans. And it's all based on where you are in the federal poverty level. It's very complicated. So typically bronze and gold and then silver in Alaska. And this is just an example. This is in no way what the plans look like here in Alaska, but it just kind of gives you an idea. And then also too, if you listen to the news or you watch any kind of, advertising for health insurance, or even when you actually go to apply and you're looking at your notice of eligibility, which I'm going to talk about, it may say that you qualify for a catastrophic. Oh, sorry. What did I do? That you're going to qualify for a catastrophic plan. But we don't have those in Alaska, and we also don't have platinum plans. They have those in the lower 48, but unfortunately, we just don't have those here.
Jennifer, another question.
Sure.
Another question. It says, we are a family of 6.
Okay.
I have 2 stepsons. Would they be covered under me? And I think you said it's whoever's on your taxes.
Correct. So it's whoever's on your taxes. So if your bonus kids are, being claimed by their biological parents, you can't put them on your taxes for that year. And unfortunately, you wouldn't be able to get them coverage through the Affordable Care Act.
Thank you.
Any other questions?
That's all right now.
Okay. All right.
I'll keep popping in.
Okay. So the next few slides are very, very busy and wordy. I'm just going to go over these. And the reason I put all this information on these slides is just so that when you look at the slide deck, you'll have this for future reference. And this is similar for your group coverage. So all marketplace coverage has 10 essential health benefits. That's the same for group coverage. And you can kind of see the list here of all those there's 10 of them. If you do not sign up for ACA, let's say that, there's been the decision that you no longer have coverage and you decide the ACA is too expensive and you're looking at other options. those options are not going to have the 10 essential health benefits. So just keep that in mind. Okay. They're not going to be required to have all of these services. And there are, I can't tell you how many people I have talked to have said, I'm paying $350 for this coverage. And I look at it and I'm like, this is not real health insurance. It's like a discount plan. Preventative care, again, this is for adult preventative care. Again, very wordy here. Preventative care is not everything under the sun. It is just a specific list, but it's covered at 100% on all policies, and that includes group policies. So, and every policy offers a free physical every year, female or male. Women, we get a little bit more. We get our, our pap smear, our women's wellness exam, mammogram, things like that. It is based on some conditions such as age, gender. For instance, lung cancer screening is only for people over 50 who smoked more than a pack a day, I think, for 15 years. So there are some conditions to them. And then there's a ton of preventative care for children under 19. You can see the list here. Excuse me. It goes 2 pages. Dental and vision. I was not aware that you guys were keeping your dental and vision. That is great. Dental and vision are covered under ACA plans for children under the age of 19. So they get dental coverage and they also get vision coverage. Some Premera plans cover adult dental, only very basic things like you get 2 exams, 2 cleanings, and a set of x-rays a year. There's no restorative care, so nothing like, fillings, crowns, anything like that. Dental plans can be purchased through the marketplace. They don't have any vision plans, but they have a vision discount plan that they tack onto those dental plans. I highly recommend that you keep your dental health insurance if you can. And I'm going to tell you why. It is the only coverage that still allows what's called a continuous coverage clause or an elimination period. So if you have not had continuous coverage, they can say, okay, well, you've signed up now, but you're not going to be able to have any fillings for 6 months or sometimes even 12 months, depending upon the plan. And as you know, a plan only runs 12 months. So you've got to guarantee that you're going to purchase that plan for an entire year before it really gives you a benefit. So if you've got coverage now, keep that coverage, okay? Because we all want to hang on to our luxury bones, right? It's very important. So, okay. This is the website that you're going to go to for getting a quote. I would like to try to do this in real time at the very end, because if I do it now, I have to unshare, reshare. I've tried it. So at the very end, I am going to kind of go in and run a quote for you guys. But keep in mind, when we're running quotes, this is going to be for 2025 policies. Again, we won't get the 2026 quotes until the end of October, but at least it'll give you kind of an idea, and we can, kind of play with some numbers if anyone wants to shout those out or type those in the chat. If you're how much you make a year, is it family, how many people are in the family, their ages, things like that. So enrolling. So open enrollment is running through November 1st through January 15th. Plans will be effective January 1st if you enroll by December 15th. If you enroll after December 15th, the plan will not be effective until February 1st. Okay. Now they had actually reversed this last month and said that they were only going to have open enrollment until December 15th. We threw away all of our stuff that said open enrollment till January 15th. And then they came back and said, no, we're going to make it through January 15th because they got a lot of kickback on it. Special enrollment period. So that is an enrollment period outside of open enrollment period. You have to have a qualifying life event. So marriage, birth, or adoption of a child, losing coverage in the last 60 days. So if you've lost your job and you've lost your coverage, moving to a different state, and there's some other provisions. Alaska Native and American Indians have a special enrollment period every single month. So you do not have to wait for open enrollment period. That is one of the special provisions. And again, if you're Alaska Native or American Indian and you're getting services from a tribal health organization in Alaska, excluding the Yukon Delta, ANTHC will purchase a Premera policy for you. And it's really cool. And I will send information out on that. This document will kind of help you gather all the information that you need if you are going to enroll. Here's the website for that, but I've also forwarded this document to Mark and he's going to send that out with the slide deck. But it's 2 or 3 page document and it just kind of gives you a checklist of everything that you need. It's a pretty good document to have. So enrolling in healthcare.gov, you're going to want to create an account. If you have had an account in the past, you're going to have to use that one again. If you've forgotten your password, you'll have an opportunity to reset it. You can even call the marketplace to reset it. Then you're going to want to complete an application for 2026. Once you've completed that application, you're going to get a notice of eligibility. This document is very important. It tells you what your advanced premium tax credit's going to be, all the coverage dates, because you don't have to necessarily enroll right away. It gives you some time. But also any further information that they're going to need from you. And if you don't give them that information, they're going to cancel your policy. And it happens more often than you would think. So I always say, please read the notice. And I'm going to talk more about that here in a bit too. And then lastly, you're going to review the plan and the plans that you like and enroll. So I'm just going to go over a couple of tips really quick here. So this is how you create an account. You go on, you're going to click on create an account. You're going to click to log in, create an account. And then you're going to have to create an account. Make sure that you're creating it for Alaska. You'll put in your information. You'll put in your create a password. You're also going to have 3 security questions that that you can answer, and they'll show those there. Once you have completed all of that, they are going to verify your identity. And often people's identity does not get verified. Do not panic. Happens more often than you think. Basically, you're just going to have to upload some information. So basically, they're looking for, like your driver's license to prove that you are a resident, your passport, a school ID. If you have recently moved, or if you've recently changed your phone number, or if you're like, I'm going to put in my social security number, but I'm going to use my husband's phone number. Some of those are red flags, and they will kick it back and say, we can't verify your identity. So just make sure that you're using the information that you've used for the longest. So if you just moved last week, you might want to use your old address, and then you can go in and update that stuff later just to make sure that your identity is verified. Because this is all tied into the IRS as well. Application tips. Once you get into the application, be sure to select Alaska. Policies are state specific. So I've had people do Alabama or Arizona or Arkansas, and then they get this wonky message that says that they don't qualify. So just make sure that you're doing Alaska. There's going to be 4 sections to the application. That's kind of here, just kind of talks about, application setup. They're going to ask for your personal household information, current coverage, life changes, and then you submit. Excuse me. This is kind of what I was talking about, how Medicare enrollment or qualification can kind of mess up the rest of the household. So this is new. This just started in August of this year. They're going to ask you if anybody is going to be enrolled in Medicare in the next 3 months. I am actually going to be losing my health insurance. So this is from my application, my son and I. So basically with the new provision, if the primary account holder becomes eligible for Medicare during the policy year, whoever else is in the household and on the policy loses their coverage. Now, then they get a special enrollment period and they can start, but they have to start over. So if your spouse turns 65 and they're the primary on the account and it's June, and you've already met your deductible for the year, you're out of luck. You got to start all over again. So to avoid that, make the youngest of the spouses, if you're married or you and your partner, make the youngest person the primary on the account if you're going to be close to that. Okay, you're going to be close to 65, and then you can avoid that. So if you're not the primary on the account and you're turning 65, it won't affect the rest of the family. Excuse me. Ugh. Another application tip, reporting income. They're going to be looking for gross income. Excuse me, I'm going to grab some water here real quick. So that is before taxes and before any payroll deductions. So it includes any income of anyone in your family. So that includes wages, the permanent fund dividend for everyone in the family, rental income, Social Security. The list is here. This is kind of interesting. Alimony before January 1st of 2019. These are things you do not include. Alimony after this period, child support, gifts, proceeds from loans, that's including like student loans, SSI, usually with children, if it's over, it's kind of complicated. So have someone look into it for you, but typically you don't claim SSI. Any VA disability, and then workers' comp benefits. This is a great website. This is a great link. If you go to healthcare.gov, go into the search bar and type income, you can get all kinds of information. Reporting income when you're doing this. So you're going to be asked to report income on two different ways. So you're going to be asked to report it on a monthly basis. They're looking at that for Medicaid. So if you have a volatile income, if you're seasonal or something like that, you can actually get Medicaid. And then when you don't qualify for Medicaid in a couple months, you can go back to getting it plan on the ACA. And then if you become unemployed, you can go back onto Medicaid. So that's what they look at. But they also look at it on a yearly basis. And the yearly basis is how they calculate your advanced premium tax credit. So what I always advise people to do is take your yearly income and then just divide it by 12 and put that in for your monthly income. And it's just a little bit more seamless. And again, PFDs do count as income. This last year, we had an energy credit, so we were able to deduct that amount. So just keep in mind, if there is an energy credit that's announced with the PFD, the only amount that's actually taxable and you have to claim is the part that's the actual PFD, not the energy credit.
Jennifer, there's a question here that says, if the child has Medicaid and the parent does not, does that affect the application or affect the parent?
No. And I'm going to talk about that actually.
Awesome.
In just a couple of slides here. Application tips. So once you have completed the application, you're going to get this. If you don't click on view eligibility notice, you're not going to be able to go to enrollment. And I can't tell you how many people call me and say, I can't enroll. I'm like, well, let's look at your application. And that's what happened. And again, read that notice. I had somebody call me and say my policy was canceled because they said I didn't provide proof of income. And I said, well, did you look at your eligibility notice when you applied? What's that? Well, they had clicked on it, but they didn't actually read it. And it clearly said on there, we need your tax return. We need this information. They didn't turn it in and they had their policy canceled. So avoid that. Other coverage options are Medicaid, Denali Kid Care, Denali Care, VA, CHAMP, TRICARE. You can try to get insurance through your spouse's employer. You can get a coverage through your parent until you're 26, but that is for group insurance only. The state, I think it's until you're 23. And if you're on VA CHAMP, I think it's until you're 21. And then again, the Indian Health Services and tribally sponsored health insurance program is a great program too. So applying for Medicaid, this is kind of, hopefully this will answer the question there. You can apply for Medicaid through healthcare.gov. We have allowed the federal government to do an automatic determination of eligibility. And then the healthcare.gov in theory sends those results over to the Alaska Division of Public Assistance. It's not a reliable method. More and more people, it's taking a very long time. I've got a consumer who we applied in December. They got a notice from the Division of Public Assistance in April saying that their application was received and they still have not been approved. So it used to be the faster, more preferred method, but since when the Division of Public Assistance gets bogged down like they are now, and quite frankly, they're 4 to 6 months behind, then I would always say go with a paper application, especially if you need coverage right away, if you're a diabetic or you have critical medications that you need to take. Definitely do a paper application. I would actually walk it down to the Division of Public Assistance. You can email it and then they'll send you an automatic, hopefully they'll send you an automatic email that says that they've received it. But follow-up will be needed for your application. In person is best. If you call them, and I can provide you with a phone number, it's going to be pack a lunch kind of thing. You're going to want to, I was on the phone for 6.5 hours trying to get somebody coverage. And yeah, it can just take a lot of time to get covered, unfortunately. Income limits for children are higher than adults. So although you may not qualify for Medicaid, your children may qualify for Medicaid. Does that answer the question from the chat, Mark?
I think they were asking, currently, if they have a child who's covered by Medicaid, and then they're applying on the marketplace, how does that? Is there implication?
Yeah. So when you list everyone in your household on the application, it's going to ask who needs coverage. So you're going to say, that child does not need coverage, and then it'll ask a little bit later, why don't they need coverage? And it'll say because you're going to mark because they have Medicaid. Got it. So it'll happen. It'll come through in the application.
If I didn't characterize your question right, let me know, but I think that's what they're asking.
Okay. This is for 2025. These are the monthly income limits. This is the chart that we create, which is a little bit more palatable from the Division of Public Assistance. I'm sure most of you can't see it right now I'm sure it's really small, but it just kind of gives you an idea of, what would be covered here. So how you read this chart here is if you're a household of one, you're between 19 and 64. This is your monthly amount. This is the most you can make to be covered for Medicaid. And this is the most you can make yearly. Okay. Children without insurance, this is their limit. So let's say that you're a family of two and it's you and your child. This is how much the limit is for a child. And this is how much the limit is just for you. Pregnant women, much higher. Okay. So that just kind of gives you an idea. And if anybody has questions about this chart, I'm happy to answer them. It can be very confusing. Some great resources. Healthcare.gov is a great resource. Again, here's a little chat bar. You type in whatever you want, and it's going to have more information than you could ever want. And it is pretty readable, pretty palatable. Beyond the Basics is a great, they're sponsored by the Center of Budget and Policy Priorities. This is more in depth. I'm a policy wonk, so this is more technical policy information, but they have some really good things like special enrollment charts, just questions about anything. And they have a lot of webinars that are recorded as well. So just some good info. Although, you know, most of the navigators, so we are a statewide, we're a statewide program, even though we're United Way of Anchorage. So we have navigators in North Pole, Fairbanks. I cover the Matsu. We have them on the Kenai. I travel all over Alaska helping people. Becky is our leader and she is going to be sticking around and she is absolutely amazing. She's been doing this for 9 years now. And you can call 211 and just ask to speak to a healthcare navigator. We're also going to have a part-time person. Her name is Joanna. She is lovely. She is from England. She's a lawyer. She's brilliant. I didn't have a picture of her, but you can also call the marketplace. This is their phone number. They pick up pretty quickly. You'd be surprised. And you can also search healthcare.gov. And here, just keep in mind, you can find an agent or a broker. They are going to be making money off of what you're doing, but they get a one-time fee regardless of the policy that you choose. Okay, so they're not going to try to upsell you because they get one monthly fee that commission that they get. So, but you can, type in your city address and try to find someone that can help you. So thank you for your time. This is my information. I will be around until August 19th. We're also going to be at the State Fair, the 21st and 22nd, but they're turning our phones off on the 20th. So yeah, feel free to email me in that time, before that time. And does anybody have any questions? Oh, and before we do questions, if I can indulge you guys, I would like to just run a quote real quick. Is that okay? Do we have time for that, Mark? Okay.
Absolutely.
I am going to get out of here. I am going to have to just do a couple of acrobatics here. So I'm going to stop sharing my screen. And
Jennifer, just kind of a general question I think might be helpful for a lot of people. Can you just help us think about, this is a big change going from employer-sponsored group coverage to not. And so, like, one of the things that I think about is coverage for dependents. Like right now, we offer coverage for dependents, but we don't pay any of the costs for it. Right. And so none of our employees currently are choosing dependent coverage. How does that, if we made a change, to me, that feels like something that's really big and possibly really beneficial for our employees, that they might have more options for dependents.
You're going to have a lot more options for dependents on healthcare.gov. It's going to be a lot cheaper for you on healthcare.gov. In the past, well, like I had said, there was that family glitch. So if the policy, the cheapest policy that your employee offers, and they look at it individually and then with your family. So in the past, so what was nice about that, and I'm talking about it even though it's not going to be available anymore, is you could still get group insurance, but if it was unaffordable for your family, they could get on ACA. Again, that's being reversed, and that's a big bummer. When I hear that people have to offer group health insurance, I go, oh, because it's always going to be cheaper on the ACA for family. Always.
Thank you. Is there anything else? Sorry.
No, I currently pay $700 a month for myself and my 2 children because I have to cover my children. Obviously, I'm losing that insurance, and I'm going to get a better plan on the ACA for only $100 a month. That's going to cover us.
Yeah.
So it's always a little bit cheaper.
Are there other things that we just don't know or realize because this is our reality right now that would be different for our employees. Dependence feels like a big one, but I don't know if there's others that I'm missing if we didn't have employer coverage.
There are other options. Some of them I don't want to talk negatively about. I just don't, because I usually get the people that have had bad experiences with them, and that's why they're coming to me. But things like share ministries, things like that. The problem with that is they can cancel you at any time. And if you have a really expensive condition, they will drop you. It happens all the time. But it's good for like basic care, things like that. And for some people, it really works out well. Yeah. There are some policies that you can purchase outside of the marketplace, like I said, but they're not going to have those essential health benefits. Typically, they don't have preventative care. One of the big benefits of having, an ACA policy, if you don't have group policy and you have children, is the dental and the vision, but you're going to be covering that too. So, but most people don't have that, unfortunately.
So back to dental and vision a little bit.
Mm-hmm.
So assuming, let's say we don't do health insurance anymore, but we do still offer dental and vision. Does that mean that because we offer those dental and vision plans, does that preclude people from having dental and vision on the marketplace then?
No, it means you have double coverage, and it's sweet.
Got it.
So I'm talking, you're not going to pay anything for glasses. You're not going to pay anything for dental care if you have double coverage like that.
Got it. So yep. Dental and vision is packaged inside the marketplace plans.
Just for children.
For children.
Just for children. Yep. And then
our dental and vision would cover the employee if we kept that. Got it.
Correct. Yep. And it would also, if you do cover children with dental and vision, then they're just going to have double coverage. And that's, for kids, that's wonderful to have.
Got it.
Okay. I'm going to run a couple of quotes. If anybody wants to throw numbers at me, I'm just going to do a quote. It's all going to be the same regardless of where you live in the Matsu. So I'm going to just increase this size here a little bit. Okay. And can everybody see that? I don't know if anyone could do a thumbs up and let me know that they're seeing the preview prices.
I think people on individual monitors can see it. Okay. And those people on group might or might not.
Okay. So this is, again, for 2025 plans. Do not skip and see full price plans because it's going to give you a heart attack. Okay. And then you're really going to need health insurance and you don't want to do that. So click on start. I would always skip this. Who's in your household? So I'm going to say, am I married? Sure. Who am I going to claim on my taxes? Yes. How many? So this is don't count your spouse. Let's say that I've got 2 children. I am 52. I am female. I'm not eligible for any things. I do have a child under the age of 19. I'm not pregnant. If you are a tobacco user, that is the only thing they will rate you on. So if you are a tobacco user, your policy is going to be more expensive. And I'm going to say that my spouse is 55. And then we'll say we've got a 15-year-old boy and a 12-year-old girl. And so then we confirm, and it's going to ask me for my estimated income. I'm going to say we're making $100,000 as a family. Make sure I got that in there right. This is what I'm going to get a month, $4,464 a month in an advanced premium tax credit. That's a lot. So it's going to let me look at the plans, and it's going to kind of give me an overview here on what the plans are going to cost. Remember how I said silver plans are always more expensive in Alaska? So bronze plans are going to be coming in at $4. Gold plans will start at 31.
So just to clarify, Jennifer, that big number we saw, that's how much, that's the credit that you're eligible for that's going to offset your plans.
Correct.
And the way that credit works is you're going to pay that monthly price that you showed us right there at the end. The government is sending that $4,000 to the insurance company every month. And then when you do your taxes, that's when you settle up, however it worked out with your actual income.
Correct. So I'm going to say a 35-year-old female, single, making $40,000 a year would get $936 a month in an advance premium tax credit. Well, it's not going to show me that, but you can see here, it's going to say was and is. And even if you're, so if the policy is cheaper than what your advance premium tax credit is, typically I think they make you pay 1 to 3% of the premium still. So that's why this policy would be $1. But you can see here that, let's go into some bronze plans are going to be starting at about $7. And gold plans would be starting with MODA at about $9. Primera is always going to be more expensive. And that's another thing I want to kind of caution you guys on, excuse me, is that most people are going to accept Blue Cross Blue Shield. And you're going to be able to have more access throughout the lower 48. MODA is more in the Pacific Northwest. They are going to be cheaper. However, they have what's called a tiered deductible system. So you're going to have 2 different deductibles. They don't really talk about that until you get into the plan documents, which I always suggest that you look at. You go into plan details, go to plan documents, and you can look at the summary of benefits. So you're going to have, they have tier 1, tier 2, and tier 3. So basically you have in and out of network with Primera. These guys have tier 1, tier 2, tier 3. 1 and 2 are in network, but you're going to have 2 different deductibles. And then you have out of network. So all our hospitals are all tier 1, but let's say that the anesthesiologist is a tier 2 and you have to have surgery, you're going to be subject to 2 deductibles. So you always want, so MODA, you just have to do a little bit more due diligence and make sure that everything is covered. So it's kind of a pain. And if you live in Fairbanks or something like that, you know, there's just parts of the nation that don't cover that or parts of the state that just, they don't take MODA. So. But yeah, those are quotes. Anybody want me to run a specific quote?
I could pull a random one out of our survey
Sure.
here if you want. So let's see, let's pick response number 6. This is a person that's not currently covered. I should probably pick somebody that is because they might not be eligible. Actually, there's a question in the chat too.
Sure.
If my husband's work offers insurance, then I cannot apply for the marketplace.
Correct.
Okay. So if you have access to any other plan, then the marketplace is not a good
Unfortunately
option.
for 2026, regardless of price too. Yeah.
Got it. All right, here's a random one from the survey.
Okay.
They have 2 people in their household. Income.
Are they married or is it just?
Oh, I don't know that. Let's say that they're not.
Okay.
Let's say it's them and a dependent. Their income is between 60 and 80, so let's just call that 70.
Okay. And any idea of how old they are?
We're gonna pretend like they're 37.
Perfect. Male or female?
They're female. It's a good.
And we know that they have a child. Okay.
Yep, they have a child, and that child probably is 14.
Okay. And we said income of about 70.
Yeah, about 70. Yep.
So they would get an advanced premium tax credit of $1,380. And plans would start at about $2. I don't ever recommend this bronze plan, but that's a different story. So yeah, bronze plans are going to start, you know, about $12 a month, which is pretty good. Gold plans, let's take a look at those. Gold plans are going to start at about 112 for MODA, about 178 for Blue Cross. And another thing that I really want to caution you on, and I wasn't really going to go over this because applying and enrolling is a whole other presentation. But one thing I want to caution you on is when you're looking at these plans is this verbiage right here. Copay after deductible. Visit from day 1. You do not want copay after deductible. That means you have to fulfill your deductible and then the copay, then you pay your copay. So if you have to see a specialist like an orthopedist or something like that, you're going to pay towards your deductible. So you're going to have to pay for the whole thing until you reach your deductible. Then you have your copayment. So for instance, this plan is from day 1. You always want to make sure it's from day 1.
Oh, got it.
So that I just want to caution you on.
Could we go back to that quote you just ran and make that a married couple instead of a dependent? Does that change
Sure.
anything?
Let's take a look. Just start. No dependents. So we're going to say 37 female. And we're going to say 38 male. Is that okay?
Yep. Still 70,000. Yep.
Yep. It's actually going to give you a little bit more.
So more of a credit.
A little bit more of a credit.
Yeah. Yep.
And again, keep in mind, the younger you are, the more expensive the policies are going to be. So I once worked with a out of dental school 25-year-old, and she got an advanced premium tax credit of $19 a month
Oh, wow.
because she was making like 150 grand a year. So,
Yeah.
but also keep in mind, if you're going to be 400% above poverty level, you're not going to qualify for an advanced premium tax credit at all. So you'll be
Right.
paying full price. And you can see the full prices on these. You know, this was $14.59 a month. You know, it's going to tell you what it was. So
Christy,
yeah.
this one we just ran was without any dependent children, so that was just two people.
Yep.
The question now is, what if it's super close, like a married couple in this situation making 102,000? So as they get closer to that 400,000 limit.
Well, again, this is going to be for 2025. So it's just going to be about $400 less.
Yeah. So the credit then would be 1,300 a month.
Yeah. So.
Question: if you don't qualify for Medicaid because you cannot give information about the other bio parent for your child and you've been denied, can you get it in the marketplace?
Yes, you can.
Okay.
Yeah. So unfortunately, Alaska's really finicky about that. Really finicky. I mean, yeah. But yeah, as long as that other parent isn't claiming them on taxes, you can absolutely. And what you're getting, so in the application, there's going to be a section that asks, have you applied for Medicaid? And then it's going to ask, have you been denied Medicaid? And you're going to want to click you've been denied, because if you click you haven't, then it's going to say you don't qualify for an advanced premium tax credit. They're looking for that denial. The only caveat is if they ask for proof of that denial, you're not going to have it. Well, you will have it. You're going to have to prove it. But I've run into that a couple of times, but it's kind of rare. Yeah. There's usually ways to get around things. We try to make the application behave. That's like, so, yeah.
Great questions. Any other questions?
I saw a hand up. Yeah.
All right.
And also too, keep in mind, a lot of the Medicaid changes that are happening, those aren't going to be happening until 2027. But unfortunately, the marketplace changes are going to be happening this year. So yeah. And
so I just want to reinforce that for everybody too. Like what we're looking, all these prices and credits, that is what is in effect currently.
Yes.
And in 2026, that will be different. And we don't know what different means. I think we probably can assume worse. Like it's not going to be as affordable. Probably is a good assumption. So all the examples that we looked at today are current rates. 2026, we can probably assume they're going to be a little bit less of a tax credit, but we won't know that until October rolls around. I guess actually November rolls around probably, when the new quotes and prices are there.
For sure. Yeah.
All right. I think that's it. So everybody, thank you so much. Let's give Jennifer a big, big thank you. And we will find her shortly at the Palmer Food Bank and work with her in that capacity. She might still answer a question if you have one about what she knows and is knowledgeable about for the marketplace. But really, really appreciate your time. I'll send this recording out. I'll send the slides out. I'll also send that survey link again. So if you've learned anything or you have any additional questions, just click right back into that survey and please provide, those thoughts or other questions or concerns that might have come up.
And there was another question in the chat I just want to address really quick, if that's okay. It says, if our insurance doesn't end until December, do we wait until it ends, or do we apply apply during open enrollment? Because the policy won't start until January 1st anyway.
Right. So the reason that we started this discussion so very early is so that we all could learn this stuff and think about all the options. So we're collecting all of your feedback right now, positive, negative, all the things. And then we would want to make a decision probably like August or September. And then we would go look at the marketplace in October. And then you would start during open enrollment. You would apply during those final months of the season so that you would have your coverage starting on January 1. So we're also sharing this information, like your feedback and the situation that CCS is in. I'm passing along to Senator Murkowski. This is important for our people that represent us to know these are choices that agencies and individuals are having to work their way through. So we started early for really good reasons. We didn't want this to be a sudden thing or the wrong decision. We wanted to look at all sides of the issue before we made any decisions.
Also, too, just fun fact, Senator Murkowski's kids are on the ACA because we helped them set up. So they're vested. Do you know what I'm saying?
Yeah.
And then it looks like somebody at Westilla Head Start has a question. Raise their hand. I don't know.
Hand up, Westilla Head Start. Not anymore.
No,
it was
okay,
an accident.
Okay.
Yep.
They were
high-fiving you with your presentation.
Sweet. And then again, I will send information on the tribally sponsored health insurance program. If I can just cover it for just a second, just to give you guys an idea, it is sweet. It is so sweet. So if you qualify and you get services, even if you're not Alaska Native, but you're American Indian and you get your services here in Alaska through a sponsored THO, Yukon Delta is the only one that doesn't participate. So I doubt any of you are dealing with that. But go to, if you're getting your services at VPC, the Valley Primary Clinic, then they've got a whole staff. I only help remote folks, so like Kotzebue, Ketchikan, those kinds of people. But they'll do a determination to see if you qualify. So you can't have an offer of insurance through your employer. Okay, that's one of the things it has to be the same rules as the ACA. But they will purchase a specific Primera policy for you, and you do not have to pay for it. So you can use, they're going to ask you to continue to use Indian Health Services because they can bill that policy and put those funds back into Indian Health Services. But what's really nice about it is you can use that policy if you want to. So if you want to pay the co-payments to see like a counselor, because I know a lot of people have a hard time getting in for mental health services through IHS, you can do that. If you fall under 300% of the federal poverty level and you have a T-SHIP policy, everything is free and you can use it anywhere in the United States, in or out of network. You don't have to have pre-authorization. It is sweet. So I highly recommend you look into it. So if you qualify. So, and I will send that information. So all right. Well, thank you so much, everybody. And please feel free to contact me if you have any questions.
Thank you so much, everyone.
Hey, Jennifer, I have one quick question.
Yes, jump in.
Since CCS does offer insurance for dependents, but it's very, very expensive.
Sure.
Does that mean my kids do qualify for Indian Health Services? Does that mean they cannot get that policy?
So they can this year if you can prove that it's more than 9.2% for the children to be covered. So not more than 9.2% of your gross family income. Because Alaska Natives get a special enrollment period every month. So they could get coverage if it's considered unaffordable.
But next year,
that provision is going away.
so next year, if we're still offering dependent coverage, even though we're not paying anything for it, dependent coverage through that is not available.
Yes. And I would talk to your insurance broker and ask if you have to cover children, if you have to offer
Yeah.
dependent coverage. It's been a while
Yeah.
since I've been in the group, and I was a health insurance agent specifically for several years. We could do a lot of exclusions back then, but things are a lot different now. So
Yeah,
but I would ask.
we will.
Yeah.
Great question. Thank you. All right, everyone. Hey, happy Friday. I hope you have a wonderful weekend. I'll send all this out, and please do share any other thoughts or questions or concerns back in that survey to us. Thank you so much, Jennifer.
Thank you. Take care, guys.